Hi, I am Dr. Sasikanth Maddu, Senior Consultant, Plastic, Cosmetic, Craniofacial and Hand Surgeon. Cosmetic breast surgeries. Breast can be a bigger size or a smaller size. There can be some problems with the breast appearance also. So, what are these breast cosmetic surgeries? It can be the breast reduction or it can be breast augmentation. Most of the time, these are the two types of breast cosmetic surgery. So, breast reduction generally we do in females who are suffering from very big breasts. So, it can be from more than what it is needed, or sometimes it can be very big breasts. These are called generally vaginal hypertrophy of the breast, especially if they occur in younger ladies. So these become so big that they cause a lot of problems in a female. For example, a huge breast, because of their weight, they can cause back pain, as well as they can cause infection between the breast and the chest wall. So similarly, in that way, so that is the reason why we reduce the size of the big breast. And sometimes because of cosmetic reasons, some people, some ladies or some women, they like to have a bigger breast. In such situation, and some women have really smaller breasts. So in that situation, we do breast augmentation. So we change the size of the breast based on the how they feel about their breast, as well as how they suffer about their breasts. So these are the two general cosmetic breast surgeries. So when do we do a breast reduction surgery? So breast reduction surgery when the size of the breast is more than what it is required. So how much is more than what it is required? It is based on the perception of the particular woman. So if the breast is causing problems, like if the breast size is very huge, sometimes they go even up to umbilicus or below umbilicus because of the huge size of the breast. So in that situation, these breasts, because of their weight, they put the extra pressure on the back to maintain an erect posture. So, and in that way, increase stress on the back and cause chronic back pain and back problems. And at the same time, because of their big size, because of the sweat and moist environment that is being maintained between the breast and the skin, chest wall skin, there can be recurrent infections in the breast. So, in that situation, breast reduction is required. How do we do breast reduction? There are multiple options, multiple ways of reducing the breast, but ultimately the main aim of the breast is we reduce the breast size to a requisite size, whatever that is needed. But sometimes how do we do that? We have a pedicle reduction, pedicle based reduction, where a superior pedicle or superior medial pedicle or inferior pedicle. There are multiple ways of reducing the breast. The breast reduction, in that way, we decrease the size based on the pedicle, which preserves the gland and the lactation and the nipple areolar complex, and we remove only the excess skin and the subcutaneous fat, excess skin and subcutaneous fat that associated with the larger breast, and we reconstruct the breast. The other way is, if the breast is very huge, we do a breast amputation and we replace the nipple and areolar complex as a free graft or a full thickness graft. So these are the two ways of breast reduction. Similarly, breast augmentation. So sometimes some women have a very small breast, maybe because of multiple reasons. So hormonal problems, or even if everything is normal, some people there will be a small breast. So how do we increase the breast size? Most commonly is by implants. So we use silicone based implants generally. These silicone implants we place beneath the breast tissue on the chest wall. It can be, there are multiple ways, multiple techniques, subpectoral, submuscle or subglandular. There are multiple ways of placing the breast implant beneath the breast. So generally for any breast surgery, either augmentation or reduction, scars are inevitable. So you will have scars. So in breast reduction, if it is a smaller size breast reduction, we have a small scar, vertical scar beneath the nipple till the inframammary fold. That is the fold between the breast and the chest wall. And whereas in breast augmentation, we have a horizontal scar on the inframammary fold. It can vary, the size vary from 2 to 3 centimeters to 5 to 6 centimeters scar will be there, depending on the size of the implant that we keep in the breast augmentation. So in addition to your this reduction by regular pedicle reduction or breast amputation or breast augmentation by implants, we have other ways of increasing or decreasing the size. The other ways are, for breast reduction, we use sometimes liposuction. So if the fatty component is more and the skin excess is less, then we can use a liposuction for decreasing the size of the breast. Sometimes liposuction and pedicle technique by reduction can be combined together, and we can do a breast reduction combining both of them. And sometimes even there is a procedure called mastopexy, where this is more like not for a big breast, it's more like for hanging breast. In that situation, what we can do is we can do a mastopexy. That means we can lift the breast. It's called breast lift or mastopexy. That breast lift, we can lift the breast, and in addition to that, so simultaneously we can keep an implant also to increase the size of the breast. So in that way, both implant as well as reduction, augmentation as well as reduction to be combined can be done together. And for augmentation, the other way of doing augmentation is by autologous fat transfer or fat injection. The same, we harvest the breast fat from the abdomen or thighs of the particular person, and we do by liposuction, and we treat the fat and we concentrate the fat and inject the fat into the breast tissue. So in that way, we do breast augmentation or cosmetic, we perform multiple cosmetic surgeries of the breast. What are the advantages of cosmetic breast surgery? Why should you go for a cosmetic breast surgery? So most of the times, a breast which is according to the wishes of the particular woman, it increases the confidence of the woman, it increases the self-esteem of the woman, and it the breasts generally they show that the woman is a complete woman. That is the reason most of the women offer cosmetic breast surgeries if given a chance.